In this video, let's learn about ophthalmology instruments. This instrument is a side port entry. In this, you can see a straight knife with a sharp pointed blade, and it has cutting only on one side. It is used to make small valvular and clear corneal incisions. It's commonly called as side port entry. So, it is used in phaco and also small incision cataract surgery. It is also used in other intraocular surgeries, including the pars plana vitrectomy. Next, the keratome. The keratome is a diamond-shaped blade with a sharp apex and it has two cutting ends. It is used in valvular corneal incisions for entry into the anterior chamber for all the modern cataract surgeries, and this keratome makes self-sealing incisions for phacoemulsification and also in manual small incision cataract surgery. So remember, a blade which has two sharp cutting edges is a keratome. The crescent knife. This knife is a blunt tip. The bevel-up knife having cut splitting action at the tip of the both sides. It is used to make tunnel incisions in the sclera and cornea for phacoemulsification. Also in small incision cataract surgery and sutureless trabeculectomy. Intraocular lens dialer or IOL dialer. So it is used to dial, as the name indicates, dialer. It is also called as Sininsky hook. It is used to dial the PMMA non-foldable intraocular lens for proper positioning. It has a bent tip which is fine. Tip of this dialer will be like this and like this for dialing the lens. It is used to manipulate the nucleus in phacoemulsification surgeries. The chopper. It resembles Sininsky hook in shape or the IOL dialer in shape. The inner edge of this instrument is bent and it is used for cutting. So it is used to split or chop the nucleus into smaller pieces and also the nuclear manipulation in phacosurgery. The wire vectis. It is very easier to remember. So this is the wire vectis. It is a wire loop which is attached to a metallic handle. It is used to remove dislocated or subluxated lens and nucleus in extracapsular cataract extraction. Castro-Vajo caliper. It is used to take the measurements during the squint or the ptosis or retinal detachment and also during the pars plana vitrectomy. It is also used to measure the corneal diameter and visible horizontal iris diameter. So commonly used during squint, ptosis or retinal detachment. Corneoscleral forceps. These are used to hold the cornea or scleral edge for incision in suturing. This is used during the cataract surgery, glaucoma, repair of cornea and also scleral tears. And also scleral tears and keratoplasty operations. Capsular excess forceps. This instrument is used after the layer of the lens capsule is raised. This instrument is used for holding the lens capsule. Iris repositor. It has a handle with blade and also blunt end. It reposits iris in anterior chamber after an intraocular surgery. It is also used to break the sinicae which are formed at pupillary margins. It has two ends, a blade and also a blunt end. The Simcoe cannula. It is used to irrigate and aspirate the lens matter in extracapsular cataract extraction. The superior rectus holding forceps. It has S-shaped double curve near the tip and these are tooth forceps. At the tips, these forceps have teeth for holding. Uses: to hold the superior rectus muscle while passing a brittle suture under it and to stabilize the eyeball during any operation such as cataract surgery, glaucoma or corneal surgeries. Superior rectus holding forceps. This forceps is used to hold the superior rectus muscle during the surgery. And you can note, see, it has an indentation and also the another handle is hooked so that it goes into this and holds the muscle. IOL holding forceps or intraocular lens holding forceps. Here you can note a spring action. And this forceps is short with blunt and curved blades. So the blades are curved like this. It has smooth edges and tips with plate form. It is used to hold the optic of non-foldable PMMA lens during the implantation. Needle holding forceps. This forceps is used to hold the needle during the surgeries. It has similar spring action as the above instrument, but here you can see the blades are small and curved. Devacker scissors. They are fine scissors with small blades which are directed at right angles. See, you can see the right angles. And the blades are kept apart, making a V shape. So here you can see the V shape. Here also you can note the spring action in between. It is used to perform iridectomy, iridotomy, and to cut the prolapsed form vitreous, and also the pupillary membranes. Corneal scissors or section enlarging scissors. You can note these look like scissors and it has no angulation. These are used to enlarge corneal or corneoscleral incision for conventional intracapsular and extracapsular cataract surgeries, to enlarge the corneal incision during the keratoplasty operation, to cut the scleral and trabecular tissue in trabeculectomy. Wire speculum. This is an eye speculum which used to keep the eyelids apart. So in between we have the eye here and it keeps the eyelid apart during the operation. It is used in any intraocular operation such as cataract surgery, glaucoma, or any extraocular surgery like squint, pterygium, enucleation, evisceration, removal of conjunctiva for corneal foreign bodies, cauterization of corneal ulcer, and also examination of eye in patient with blepharospasm. Lacrimal probes, also called as Bowman's probe. These are set of straight metal wires of varying thickness. They are sized from 0 to 8 with blunt rounded ends with a flattened central platform. Uses. It is used to probe the nasolacrimal duct. In case of obstructed nasolacrimal duct, this probe is used, that is in congenital blockage, to identify the lacrimal sac during the DCT or the DCR operations. Bone punch. It is used to enlarge the bony opening during the DCR operation. As the name indicates, bone punch, it is used to punching the bone from margins of the opening. Lacrimal sac dissector and curette. It is a cylindrical instrument in which one end is a blunt tip dissector here and the another end is curette. It is used in lacrimal sac surgery. So this is a lacrimal sac dissector and curette. It has two parts in one instrument. This is enucleation spoon or optic nerve guide. This depression is to hold the optic nerve. It is a spoon-shaped instrument with central cleavage. It is used to engage the optic nerve during the enucleation surgeries. Evisceration curette. It consists of an oval or rounded shallow cup with blunt margins, which is attached to a handle. Usage. As the name indicates, it is used to curette out the intraocular contents during the evisceration operation. The lid clamp or entropion clamp. It is a self-retaining instrument. There will be a screw here to hold the instrument in place. It has an advantage over the lid spatula. It is a self-retaining instrument. As I said, here will be a screw to hold the instrument in its position. Disadvantage is operative field is less. Pressure necrosis can occur if fitted tightly. And uses. It is used in surgeries like lid surgery, example entropion surgeries, ectropion surgeries. It protects the eyeball, supports the lid tissue and provides hemostasis during the surgery. Chalazoin clamp. It consists of two limb-like forceps which can be clamped with the help of a screw. So this is the screw here. The tip of one end is flattened in the form of a round disc, while the another arm holds a small circular ring. Usually the flat disc is applied on the skin side and this ring is applied on the conjunctival side of the chalazion. It is used to fix the chalazion and the hemostasis during the incision and curettage. Muzzle or strabismus hook. It is similar to the lens expressor in appearance, but it has a blunt knob which guards and prevents the muzzle slippage. It is used to engage the extraocular muscles during the surgery for squint, enucleation, and retinal detachment. It is used in the absence of lens expressor, and it may be used in a place of lens expressor. So this is a lens expressor. It is a flat metal handled instrument with a rounded curve at the end. The tip of the curve is knobbed. The plane of the handle is at right angle. It is used to apply the pressure at the limbus, that is the 6 o'clock position, during the delivery of lens in the intracapsular cataract extraction. To express the nucleus in the extracapsular cataract extraction, it can also be used as a muzzle hook, also used with wire vectis to extract the dislocated lens. Ptosis clamp. It is a forceps which has J-shaped ends. It have internal serrations and the clamp has a locking mechanism. It is used to hold the levator palpebrae superioris muscle during the ptosis surgery. Evisceration stand. It helps to keep the eyeball after the evisceration surgeries. Self-retaining lacrimal wound retractor or the Muller's retractor. It is made up of two limbs with 3 curved pins on each engaging edge. The limbs are kept in retraction position with the help of a fixation screw. Its uses. It is used to retract the skin during the surgery on the lacrimal sac. Kellman-McPherson forceps. These are a fine forceps, so the ends are fine. It is used to hold the superior haptic of the IOL during the placement, used to tear off the anterior capsular flap in the extracapsular extraction, and can be used for suture tying. So this is a Kellman-McPherson forceps. The Maddox rod, which is used to detect strabismus in both the near and far vision. This is an injector through which the foldable lenses are passed into the lens capsule during the cataract surgery.